السلام عليكم. أنا دكتور إبراهيم السعيدي من مستشفى صدر إمبابة، ودي كانت رسالة الدكتوراه في عين شمس. بسم الله الرحمن الرحيم. Assessment of endobronchial chemotherapy in patients with bronchogenic carcinoma. Lung cancer is a significant public health problem all over the world. It has become the leading cause of cancer death in many industrial countries. Unfortunately, the majority of patients with recently diagnosed lung cancer are inoperable. Patients presenting with inoperable non-small cell lung cancer associated with severe bronchial obstruction are at high risk for developing post-obstructive pneumonia, respiratory failure, or both. This often leads to death in weeks to months. Multiple studies suggested that tumor debulking and airway recanalization has a considerable role in increasing survival and improving quality of life in patients with inoperable lung cancer. There are multiple modalities that have been suggested for this palliative role. They include thermic procedures using extreme heat or cold, such as cryotherapy, electrocautery, or laser resection, brachytherapy, and endobronchial stent insertion. Endobronchial intratumoral chemotherapy and called EITC is a novel interventional bronchoscopy technique which involves injection of one or several cytotoxic drugs directly into the tumoral tissue through a flexible bronchoscope by means of an ordinary transbronchial aspiration biopsy needle. It is a non-systemic, loco-regional chemotherapy aims at reduction of large local tumor cell burden, rapid alleviation of endobronchial obstruction, and enhancement of quality of life for these patients. The aim of the present work is to determine the efficacy of endobronchial intratumoral chemotherapy using the 5-fluorouracil as a chemotherapeutic agent in palliative care for patients with inoperable non-small cell lung cancer. The study included patients referred to the pulmonary medicine department at Ain Shams University Hospital and Imbaba Hospital with newly diagnosed inoperable symptomatic non-life-threatening airway obstruction secondary to non-small cell lung cancer. 30 patients diagnosed as inoperable stage 3B, 3C, or 4 non-small cell lung cancer enrolled in the study and divided into two groups as follows. Group A patients, 15 patients received the conventional sessions of systemic chemotherapy, and Group B patients, 15 patients received the conventional sessions of systemic chemotherapy in addition to sessions of local endobronchial intratumoral chemotherapy using the 5-fluorouracil. Inclusion criteria: patients with symptomatic non-life-threatening airway obstruction by at least one endobronchial tumor. Exclusion criteria: general contraindications to bronchoscopy, and patients with previous history of allergic reaction to 5-fluorouracil, patients with Karnofsky score less than 60%. All included patients were subjected to the following: detailed medical history taking, clinical evaluation before the procedure included evaluation of dyspnea grade using the Modified Medical Research Council score and called MMRC, and evaluation of performance score and called Karnofsky score. Laboratory investigations included complete blood picture, coagulation parameters, and oxygen saturation measurement. Radiological evaluation included chest X-ray posterior-anterior view, initially for all patients, and after each session of endoscopic intratumoral chemotherapy for Group B patients. CT of the chest for all studied patients before treatment to evaluate the size and local extent of the tumor, and another CT 1 week after the treatment for comparison. Pelvic-abdominal ultrasonography, CT of the brain, and bone scan whenever indicated. Flexible bronchoscopy evaluation for groups A and B patient to determine site and extent of the tumor obstruction before treatment and after treatment, and also for group B patients bronchoscopic evaluation recorded at each session to evaluate the response to the previous sessions of local 5-fluorouracil injections. This was the bronchoscope at Ain Shams University Hospital, and now the whole unit is renewed. And this is at Imbaba. This is the needle we used to inject the 5-fluorouracil locally inside the tumor. Technique of bronchoscopic intratumoral chemotherapy injection. Direct injections were carried out on weekly basis for 3 sessions, days 1, 8, and 15. At every session, piecemeal extraction of the resultant necrotic tissues was done using the forceps and the extent of lumen restoration recorded. At every session, 0.5 to 1 gram of 5-fluorouracil was injected in a concentration of 50 milligram per milliliter with a maximum of 20 milliliter. These are the different modes of insertion of the needle during a bronchoscopic intratumoral chemotherapy injection, according to the extent of wall invasion and lumen invasion. Evaluation of response to treatment, subjective assessment and objective assessment. Subjective assessment included improvement of dyspnea grade according to MMRC score and performance status according to Karnofsky score. Objective assessment, evaluation of therapeutic effect of the local chemotherapy according to the new response evaluation criteria in solid tumors and called the revised RESIST guidelines. These guidelines stated that good response means more than 50% increase in caliber of the lumen, partial response equal 25 to 50% increase in the caliber of the lumen, no response means less than 25% increase in the caliber of the lumen, and progressive disease means 25% or more increase in the size of one or more measurable lesions or the appearance of new lesions. Results. These are the demographic data of studied patients. Most patients were around 60 years and most patients were males. Presenting symptoms, comorbidities, and baseline oxygen saturation. Shortness of breath was present in all patients, followed by cough, hemoptysis, and chest pain. CT chest findings among patients in the two groups. For sure, right lungs were more affected than left lung. Bronchoscopic distribution of the tumor among patients in the two groups. Right-sided bronchi were more affected. Histopathological types of lung cancer among patients of the two groups. TNM staging and the disease stage among patients in the two groups. As we said before, all patients were in groups 3B, 3C, or 4. Numbers of sessions of local chemotherapy in patients of group B. Most patients received 3 sessions. Complications related to bronchoscopic intervention in patients of the two groups. One patient developed hemoptysis and another patient developed hypoxia. And these complications were dealt with properly and did not result in late complications. There were no complications related to the 5-fluorouracil used locally in group B during bronchoscopy. Systemic chemotherapy treatment for patients of the two groups. MMRC dyspnea score before and after treatment of the patients of the two groups. There was no significant statistical difference. Karnofsky score before treatment and after treatment for patients of the two groups. There was no significant statistical difference. The total objective response of studied patients of the two groups after treatment according to revised RESIST guidelines. None of the included patients showed good response. Some patients in group A showed partial response. Most patients in both groups showed no response, and in minority of patients, the disease progressed. There was no superiority of using this drug by means of AITC for such patients over the systemic chemotherapy alone. And to conclude, lung cancer is the leading cause of cancer-related mortality in the world. New local therapeutic modality for non-small cell lung cancer was introduced and named AITC using the flexible bronchoscope. AITC is a less invasive and relatively cheap and has less risk of complications as compared to other interventional therapeutic bronchoscopic procedures. In our study, AITC using the 5-fluorouracil did not result in debulking of the tumor mass, improvement of the bronchial lumen diameter, or decrease of the size of tumor, and so no superiority of using this drug by means of local injection for such patients over the systemic chemotherapy alone. Recommendations. Further research is conducted on larger number of patients with longer periods of follow-up are needed to properly assess the role of AITC in management of lung cancer. Future researches are needed based upon selection of local chemotherapeutic agents other than 5-fluorouracil for AITC. Future researches are needed based upon comparing AITC with other interventional therapeutic bronchoscopic procedures in the same thesis, and future researches are needed based upon the evaluation of combining AITC with other interventional therapeutic bronchoscopic procedures aiming at decreasing the tumor size and improving the quality of life and survival rate. And thank you.